New data from the World Health Organization suggests that Africa is set to miss the urgent global goal of vaccinating 10% of every country's population against COVID-19 by the end of September. 42 of Africa's 54 nations are set to miss this target, that is, if the current pace of vaccine deliveries and vaccinations continues as is. Joining us now for an assessment of the situation is a new vaccines introduction medical officer at the World Health Organization in Africa, Dr. Fiona Atuhebwe. Dr. Atuhebwe, good to have you with us on the Daytime Update today. I was wondering how the deadline of end of September was actually set. Could you talk us through that?
Thank you very much, Tammy. So during the World Health Assembly in May, which is a congregation of all ministers of health globally and all civil society and all partners that work to contribute to the Sustainable Development Goals, especially those that pertain health, and these are the people that really bring us, really cross-check what we are doing and also help us set targets. The Director General of the World Health Organization then in May set this target because of equity reasons to say we need to have at least some targets we are working towards to the end of the pandemic. And then mathematical modeling that shows us how, given the current supplies that we have globally, if spread through the world, and if we are to end the pandemic, because the pandemic being global, then the whole world needs to end it at the same time. The modeling showed that by end of September, we needed to meet the target of at least 10% of the populations vaccinated.
And what have you found to be the main reasons why there is a lag in the vaccination process, and which of the countries have been affected most?
The main challenge really to vaccine deployment in Africa has been the unavailability of anticipated supplies globally, which effectively locked COVAX out of the market, along with the interruptions of supply. Of course, we all know what happened in India. Interestingly, our surveillance shows clearly that the more vaccines that arrive in Africa, there is a mirrored increase in uptake. So our issue really shows that in Africa, the problem is the vaccine supply, not the vaccine uptake. And this confirms, and of course, again, we have the fears that the vaccine safety fears and misinformation are certainly factors in vaccine hesitancy, but our tracking shows that given the latest waves and people who have now understood that actually COVID exists, the hesitancy has reduced also in Africa. So we have, like you mentioned, a few countries that are set to meet the target, about 10 to 12 countries so far, who are on target to hit the 10% target by end of September. And these are mainly the small island countries like Seychelles, Mauritius, Cabo Verde, Comoros, and Sao Tome and Principe. We also have countries that have smaller populations, like Eswatini and Botswana. Then we also have those countries like South Africa that have done a great job in securing vaccine quantities and in vaccine acquisition. South Africa, Tunisia, Morocco, Zimbabwe, and Equatorial Guinea.
We are seeing an increase in the number of vaccines arriving on the African continent. In the month of August alone, there were 21 million COVID-19 vaccines arriving on the continent. According to the number that I have now, about 143 million doses have already been received on the continent. What is the total number, the target number, the ideal number of vaccinations that are needed through this COVAX facility?
So generally in Africa, by the end of the year, with the target that had originally been set for 30%, we expected to have at least 820 million doses. And this target has shifted a bit now to 40%, given that we're having more supplies coming in expected. So about 1 billion doses that we need on the African continent to be able to hit these targets. So for now, we have the COVAX facility being the main source of vaccine that has come to the continent. The African Union has also told us that we expect to get at least 10 million doses per month from them till the end of the year. So those are extra in the next coming months, 40 million doses. But then we also have bilateral deals that countries are having directly with donor countries that are donating doses. So we expect really to hopefully get to this to this number that we are looking for, just slightly over 1 billion doses.
And what seem to be the challenges between the arrival of the vaccine, so there is availability, but not much uptake, with only 3% of Africa's population already having been vaccinated?
Like I mentioned before, Tammy, the issue actually is not the uptake. The issue is the availability. We have over 80% of the vaccine doses that have arrived on the continent being absorbed as quickly as possible. Even when now they come with a short shelf life, countries are able to take them up because the populations are waiting. However, this doesn't mean we don't have challenges. We have challenges such as ultra cold chain. We got a good donation of vaccine from the US government, which was majorly Johnson & Johnson and Pfizer. As you all know, Pfizer requires special handling mechanisms. So a number of countries, when we started, only 8 countries in Africa had the ability to handle Pfizer doses. But now, by the end of August, we have had this number increase, and by end of September, we hope actually that about 90% of African countries are able to handle Pfizer doses. So we have an issue of cold chain. We also had an issue of operational funding at the beginning, where vaccines came to the country, but countries were not yet ready financially to deploy them. But now funds have been put out there. Countries have applied for Gavi accelerated funding, which was put out to support them to roll out the vaccine. World Bank has given funds. Governments have put in a lot of funds, like South Africa has invested a lot of money in ensuring that the populations get these vaccines. Right now, as I mentioned, the challenges are really not the uptake. The challenges are the supply.
And what type of interventions is the World Health Organization putting in place to try and ensure that these 42 out of 54 countries will actually get as close as possible to meeting that target?
So as WHO, we are really working tirelessly to support countries to ensure that they hit this target, at least by the end of this month, to hit that 10% target. We are revising our allocation mechanisms to get back to the equity. At first, we were not considering, for example, countries that had bilateral doses, but now we are trying to push the countries that have a low coverage, that may not hit the 10% mark. We are trying to ensure that we give them much more doses to be able to get them also to that 10% mark. We are working closely with countries to boost also factors such as logistics. As I mentioned, like the Pfizer doses are coming, we are working very closely with countries to do the assessment. Do you have any ultra cold chain in the countries? If they do not, we are working closely with Gavi and UNICEF to procure ultra cold chain and bring it to the countries, train the health workers on how to use it. And we are also overseeing completion of self-assessment reports that countries are doing to help them identify and address key challenges around the vaccine deployment. And we are using this information to update what we call the micro plans. So once you have vaccinated your priority groups, and in any case, when you said you're vaccinating the priority groups, did you reach everyone in the priority group? If you did not, how do we help you reach them? And we are going to that detail. And if they are done with their priority groups, we are helping them map out the next group that will receive the small doses that we have. But also, we know we are also providing technical support to plan for planning and capacity building and monitoring and evaluation, but also most important, safety surveillance, which is WHO's one of our core mandates once the vaccine is rolled out, to ensure that we look out very closely for any adverse events following immunization and manage to solve these as quickly as possible. Of course, on top of that, we are trying to ensure that we use all the other SOPs and interventions we have stationed many people in cities where we are having the epicenters of this pandemic in the countries to stop this, the more transmission. But on top of that, I need to note that we've deployed over 700 experts in the various African countries to help them with this vaccine ramp-up.
You mentioned the issue of vaccine inequality as well as vaccine hoarding as one of the key impediments. What is the global consciousness now from the donor countries? Is there more of a higher propensity for wanting to donate vaccines to COVAX as well as other existing instruments?
We are actually seeing countries. When the G7 met, we have seen such a big difference. The US giving out 500 million doses is no mean achievement that we've had. The Team Europe are still giving us, we did have a lot of vaccination with AstraZeneca at the beginning in Africa, and when India closed the exportation, we had issues with the second doses. But Team Europe, these are the European Union countries, and the UK have really continuously given us doses to ensure that we meet the second doses. We're also having donations from countries like Japan. We are really, for example, most of the vaccine that has arrived now from the COVAX facility to the countries has come from donations, and we really applaud the wealthier countries for listening to our plea, the Director General's plea from the World Health Organization, and sharing these doses.
Doctor, before I let you go, comparatively speaking, how intense and dire has the impact of COVID-19 been on the African continent compared to Europe, for example, and the United States?
We know for sure that what we've seen on the African continent has originally in the first wave, apart from South Africa, by the way, which really did South Africa and Morocco and in a few northern African countries that contributed to 50% of all the cases and deaths, Africa was not as badly hit as the Western world was hit. So in effect, it raises the likelihood of African countries, of course, experiencing a fourth wave. The issue we have in Africa is not the numbers that we get. The problem is our health systems are so fragile and unable to handle the heavy cases that come. Even if there are 10 cases, you'll find countries that have just 20 ICU beds in the country. And if a country has 20 ICU beds and we just get 30 ICU requirements, that means that we are going to lose 10 people. As that one, we know that we are going to lose these 10 people. Our issue is our health systems are unable to cope like the Western world health systems can cope. But now that they have also vaccinated, they are seeing less hospitalization and less deaths, which is what we all would want to look at. So with our fragile health systems, in order to curb the hospitalization and deaths and maintain functional health systems, because other diseases have not waited. They are still there. People are still sick and dying. So to be able to also put back our systems in order, our economies in order, we also need to be able to vaccinate and get to where the Western countries have gotten.
Does this mean, Doctor, then, that most of Africa seems to be less prone to contracting COVID-19 than those who are in the Western world, if, as you say, the issue is not so much the numbers that we're getting, but a lack of proper medical care and attention when one does actually contract COVID-19?
No, that is not the truth. We are all vulnerable and at the same stage of vulnerability. All of us are vulnerable. Only that they have better healthcare systems. We all are prone. We have seen what the waves do. A wave will come and devastate a whole country. So we are all susceptible, and the vulnerability is the same at all levels of country, in all countries, wherever you are. The difference is the access to health facilities and healthcare. That is the only difference we face. So again, all other factors constant, I get sick in one African country, someone else gets sick in Europe. Chances are, if we are at the same level of access of normal life, I may not be able to access a facility much as they may be able to access all the essential services that they need, and higher chances of me losing my life.
Dr. Atu Hebwe, thank you so much for your time and your insight regarding this matter. She is from the New Vaccines Introduction Medical Officer at the World Health Organization.